My name is Alain Vaval. I'm a non-invasive cardiologist with Albany Associates in Cardiology. St. Peter's has, for many years, been a leader in cardiovascular care. We provide full spectrum cardiac care, from preventative cardiology, where we take people who are at risk for cardiac disease and try to mitigate their risk factors and prevent them from ever developing disease, to secondary prevention, where people have had problems and heart attacks or valvular disease or heart failure, and we try to prevent them from having progression of disease. So we provide care with, in a team approach with our group, but we also rely heavily on the cardiac surgeons. The approach to care is really to help educate patients, because I think that's really the cornerstone of providing good care to patients, to have them understand first off what their illness is, how to manage their illness, and how to look out for complications of their illness so that they present for care at the appropriate times. I often have patients show up late in disease or after they've already had an event, and I think to myself, wow, I wish they would have come in sooner. And if someone comes in and they're having heartburn, but we evaluate them and we're able to educate them and say, hey, look, these are your risk factors. You're at high risk for having a problem, or you're at moderate risk for having a problem, or you're at low risk for having a problem. And these are the signs and symptoms I want you to look out for. And these are the things that I think should prompt you to come back into the office. That's the education piece I'm talking about, so that you can really make a big difference in someone's life in terms of how they, quality of life, how they feel, the types of activities they're able to do. Someone comes in heart failure, you start them on therapy, they go from maybe not being able to walk up a flight of stairs in their house to going back to work and being able to perform all their activities of daily living. So that can be a really rewarding thing to do for people.